Joe Rogan announcing today on Instagram.
Joe Rogan said.
Joe Rogan, an extremely popular podcaster, announced on social media today that he has COVID. And on social media, Rogan said he has taken several therapeutics to recover. One of those drugs he mentioned, Ivermectin, is something more often used to deworm horses.
Rogan also sharing that he's taking the drug Ivermectin, meant to treat parasites and worms in horses and other animals.
Says with a mixture of medicines, including the controversial horse dewormer that has poisoned hundreds of people nationwide.
Despite being unproven as a COVID treatment, Ivermectin has received a recent boost from online misinformation, prompting warnings from the FDA and other health officials.
Did you see that thing that the FDA put out? It was a tweet.
The FDA tweeting last month, "You are not a horse, you are not a cow. Serious, y'all. Stop it."
Please join me in welcoming Dr. Campbell, who will present his Nobel lecture under the title Ivermectin, a reflection on simplicity.
It was an exciting moment for both of us. We made our pitch, and they approved a trial of ivermectin in humans. So the result is that this drug has been given away in increasing amounts over the year. It's now been going on for 25 years. It's now up to the incredible number of a billion, more than a billion treatments given away in this space of time.
CDC says there's no evidence it works on COVID. Increased usage has only led to a substantial increase in overdoses after a push by some on the far right citing vaccine misinformation. Why are people using this? What is the theory that it works?
Oh, not only are we saying that there's no evidence it works, it goes beyond that. We actually know that it doesn't work. It doesn't work.
First of all, Dr. Kory, please explain who you are and introduce yourself.
Yeah, sure. So I'm a lung and ICU specialist who's part of a group of other ICU specialists. We came together early in the pandemic to develop treatment protocols for COVID. And then more recently, we have an outpatient treatment protocol centered around the drug ivermectin. And as a guy who's been immersed in this data, who's been living with it, who's a physician who's been using it. I mean, I've been using it for 8 months. I am part of a network of physicians around the world that I talk to regularly. We know how effective it is. Other parasitic diseases for which ivermectin was approved as the standard of care worldwide, 10 trials with 852 patients. Right now, ivermectin is sitting on 24 randomized controlled trials with 3,000 patients, and it's not being recommended. It's
what are the results? The ivermectin trials.
So just published this weekend this is a group of researchers who their main job is to review medical evidence to formulate guidelines for the big national and international healthcare agencies. They did this work independently. No one paid them to do this work, and they started researching, and they found that there was on average a 62% reduction in death when you used ivermectin. It's not in every trial where they treated early. When you look at the early versus late, they do so much better.
What are the results for early? Do we have
early around 80% reduction, and sometimes even higher in hospitalization and death.
And they found that there was no benefit for ivermectin in reducing mortality, no reduction in symptoms or duration of symptoms. So it does not work. This is not something that should be done. And I think the greater harm here is that it provides this false reassurance. People are now going about saying that they can do whatever they want with the understanding that there is this magic pill to save them at the end of the day, except that it's not a magic pill that actually works.
But the ones that you took weekly led to like near perfect protection, like 100% protection in a large population of healthcare workers. Now, in 1,200 healthcare workers, 800 who took this regimen, 400 who didn't, not one of, it was 788 healthcare workers got COVID over like a 4-month period.
Well, wait, but
not one of them got COVID.
Not one of them, but these were frontline workers
Yes.
who were so thoroughly exposed to COVID that 57% of the people in the 400-person control group who didn't take ivermectin did get COVID. That's a huge distinction. That number is plenty high to drive COVID to extinction, and I would also say drive COVID to extinction.
Well, I think there are some people who want to believe that there is a magic pill for COVID, which of course we would all want.
Rogan said the word ivermectin. Yes, that's the deworming medicine made to kill parasites in farm animals.
So things are clearly bad.
but they're being made even worse by people who have refused to take the vaccine and instead are swallowing horse paste.
Wait a second. He said that he got better because he ate cattle dewormer.
You have individuals like Joe Rogan, for example, who don't want to take an experimental vaccine but will take horse dewormer.
Ivermectin is often used to deworm livestock.
Ivermectin apparently given to deworm animals.
Joe Rogan, he came down with COVID. He says he's been taking the livestock dewormer ivermectin.
Ivermectin is a drug that is commonly used as a horse dewormer.
He also acknowledged taking a controversial treatment designed for animals.
He may not have gotten it from the feed supply store, but it's the same compound.
With many people turning to a pro-Trump telemedicine website with hopes to get it.
But when you have a horse deworming medication that's discouraged by the government, that actually causes some people in this crazed environment we're in to actually want to try it. That's the upside down world we're in with figures like Joe Rogan.
What we need right now is a clear message to the people of this country. This message must be read in every newspaper, heard on every radio, seen on every television. I want this country to realize that we stand on the edge of oblivion. I want every man, woman, and child to understand how close we are to chaos. I want everyone to remember why they need us.
In the former United States, civil war continues to devastate the Midwest.
Scientists attribute this latest water shortage to the lack of rainfall the last 2 years. Ministry officials expect water coupon prices to rise.
Police have arrested 9 suspects.
Can you believe this shit?
Reporting avian flu
going on all summer.
Outside the quarantine zone, a new airborne pathogen has killed 27 people.
Joe Rogan says he has COVID, taking livestock drug despite warnings. Yeah.
Jamie had to pull this up.
You want to play it?
Does she
This
have
is
Kory?
your news network.
I'm going to watch.
Let's see.
Rogan telling his 13 million Instagram followers that he was treated with several drugs, and he included ivermectin on the list, a drug used for livestock. The FDA and the CDC warn against using to treat COVID.
Turns out I got COVID.
Look, they put a
So
yellow
we
filter on me
immediately
too. The kitchen sink at it. All
They
kinds
did.
of meds. Monoclonal,
You see the original
antibodies,
video versus that? I look like shit there.
Z-Pack.
Do you know that?
I think you look good.
But don't you think that a lie like that is dangerous on a news network when you know that they know they're lying?
The thing is, we're like going so fast. Like I feel like I'm missing.
Do you think that's a problem that your news network lies?
Well, I don't.
Dude,
I mean, what did they say?
They lied
What did
and
they
said
say?
I was taking horse dewormer. That's a lie that they're conscious of. It's not a mistake. They're unfavorably framing it as veterinary medicine. Why would you say that when you're talking about a drug that's been given out to billions and billions of people, a drug that has been shown to stop viral replication? Why would they lie and say that's horse dewormer? This is ridiculous. It's just a lie.
I don't think anyone. I think what 250 million people have taken it around the world.
More,
I get that.
Way more.
So
way more. Billions of people have taken it.
It can be used for humans. I get it. I totally.
Not just could be used for humans. They know it's a human drug.
It's right. But
they lied.
Well, see, here's the thing. You can have nuanced discussions about this.
No,
right?
you can't.
Yeah,
you can't have nuanced discussions about lying about someone taking horse dewormer.
I want to talk about two things
no.
on the ledger.
You have before we get to that. Does it bother you that the news network you work for out and out lied, just outright lied about me taking horse dewormer?
They shouldn't have said that.
Why did they do that?
I don't know.
Do you understand that that's why people get concerned about the veracity of the news?
All of the agencies, and I can bring you a stack, EMA, which is European Medicines Agencies, which is all of Europe, France, Netherlands, like all of those Western European countries, Canada, the US, the NIH, just look at their reviews of ivermectin. It's almost like they've copied and pasted all around the world. Every agency that's reviewed it has said that it's low quality evidence, small trials, poor control groups, but it's like they've copied and pasted it. They're not credibly assessing the data around ivermectin.
An investigation into 26 clinical trials into the use of Ivermectin to treat COVID has found serious errors or signs of potential fraud.
So the main issue is that a very large number of these studies are simply fake. They're false, they either did not happen at all or reported false results.
Another absurdity is Mexico. They did something that I think is unique, historic, and needs to be recognized. Hospitals were full. They were getting inundated. They're almost like at that crisis peak. Mexico was in terrible condition back in December. They implemented a nationwide test and treat program. Every outpatient testing center, if you tested positive, you were offered ivermectin. You got 2 days, you got 12 milligrams, which is not a high dose. But what happened within 2 weeks of that, hospitalization rates plummeted, death rates plummeted, at a time when the vaccination rate was like 1 to 5%. So it wasn't the vaccines. And then 3 weeks ago, that agency put out their paper looking at the data of their program. And you know what they reported is that in many thousands of patients, those that accepted the medicine and took it, their rate of hospitalization was up to 75% lower than those who didn't. Why isn't that front page news in the major media in the United States? You have a large country like Mexico, incredible what they did. You know how many lives they saved by reducing that hospitalization? And they emptied the hospitals. They emptied them.
Like, what is the expense of ivermectin?
Oh, I've seen it estimated like in large bulk quantities, you could make it for less than $1, like a dose. It's extremely cheap. It's a very low cost.
That's
drug.
a problem. So extremely effective, extremely cheap, and generic.
This is a system at work, a health system which favors for-profit medicines over non-profit. Effectively, it's a dishonesty. Their objective is to not have ivermectin adopted worldwide. Ivermectin is seen as an opponent to whatever policies or pharmaceutical products they want to bring forward.
Imagine a virus, the most terrifying virus you can, and then imagine that you and you alone have the cure. But if your ultimate goal is power, how best to use such a weapon? Several hundred die within the first few weeks.
Authorities are attempting to control its deadly spread. Sends a wave of destruction throughout the underground.
Fueled by the media, fear and panic spread quickly, fracturing and dividing the country until at last the true goal comes into view. And then not long after the election, lo and behold, a miracle. Some believed it was the work of God himself, but it was a pharmaceutical company controlled by certain party members that made them all obscenely rich. But the end result, the true genius of the plan, was the fear. The rest, as they say, is history.
The key thing that I want to communicate is that this is a treatable disease.